Hi, my name's Madeline Gardner. I'm a registered nurse at Fairview Riverside, and nurses support sick time for everyone as a public health policy that really makes sense to keep everybody well. I want to speak specifically to the necessity of including casual nurses in getting sick time. So every year at the hospital, the administration puts up signs at every entrance that says, if you're sick, don't come to the hospital. Don't visit anyone, don't come in. Because the vulnerable people at the hospital are at risk of getting secondary infections, small babies, elderly, people with immune suppression. Now, casual nurses make up a small but important amount of the nursing workforce. And as nurses, we care very much about protecting our patients. We don't want to expose them to anything. So we need the support to stay home when we're sick and not expose our patients to illness. Just like anyone else, casual nurses get sick. And just like anyone else, casual nurses depend on the income that they get from their jobs. So who's a casual nurse? I will be a casual nurse this summer. My husband will be working full-time in healthcare, and I'm going to move to casual to have flexibility in my schedule, but we're still going to rely on my hours, and I'm going to need that sick time when I get sick because I don't want to expose young babies to being sick. So I would ask each of you city council members to think, if you've had a child or if your grandma was in the hospital, how would you feel if the nurse who was taking care of them was sick? We want that nurse to stay home, so we should give her the support to do that. Likewise, on my unit, the other nurses who work casual, some of whom work a lot of hours, you know, as many or more as many of the scheduled employees. Many of them are moms who take care of their kids, and they need the flexibility, but they still need that income. Thank you.
Thank you, ma'am. Speaker 2, and then 3 is Tyrone Spencer, 4 is Guillermo Lindsay, 5 is Rupa Kreiser.
Thank you very much for having us. My name is Charlotte Zabowen. I'm a registered nurse of over 35 years and a member of the Minnesota Nurses Association. I worked as a casual RN at 2 Minneapolis hospitals for over 10 years as a casual nurse and over 25 years as a nurse. When my kids were young, I took a casual status RN position when no part-time or full-time positions were available. At first, I was apprehensive that there wouldn't be enough shifts as a casual for me to contribute to the support of my family. I soon found there were plenty of shifts available as the hospital really relies on flexible casuals to fully staff the hospital on any given shift. At times, I was picking up as many as 32 hours a week, or at a 0.8 schedule as a casual RN. However, unlike another RN who is scheduled 0.8 at the same hospital as casuals, we don't earn benefits such as earned sick time, health care insurance, or vacation time. When we pick up shifts in our schedule, there's a lot of pressure to come to work, sick or not, as we are filling staffing holes in the schedule. And also we suffer the loss of income when we are sick and aren't able to come to work for those shifts that we have been scheduled for weeks ahead. This exclusion of casual healthcare providers assumes casual employees don't rely on these jobs for income to support their families. I do. This exclusion assumes that casual healthcare providers don't get sick and come to work. I did. This exclusion assumes that casual healthcare providers don't need pay sick and save time just like all workers in order to keep our communities safe, as we all do. We strongly urge you to amend this ordinance to include all casual healthcare workers, just like all workers are covered under this ordinance, whether half-time, full-time, or casual status. Thank you.
Thank you, ma'am.